if you have decreased eversion in your ankle, right, when the heel bone moves out, it can affect your pelvic floor. And believe it or not, this ankle motion pretty much affects every joint in your body when you're moving in weight-bearing positions. So you can get this, you get this chain reaction that occurs. It'll either support pain-free function or it'll lead to dysfunction over time. And so you want to make sure you've got nice eversion of that heel bone, because that can affect a lot of things. Limitations in your thoracic spine can lead to your respiratory diaphragm not loading symmetrically, which means both sides even, and your diaphragm isometrically impacts the loading and exploding of your pelvic floor. So in other words, you have to have full motion in your rib cage to have good pelvic floor function. And a lot of people have limited rib motion, right? If you struggle to turn to see while you're backing up when you're driving or when you're pulling out or when you're parking, then you've got limited rib motion, and it's important to address that and restore that, because that will affect your pelvic floor. Limitations in one or both hips can also affect pelvic floor function, rendering it to be switched off. And a lot of times this happens with total hip replacements, with hip fractures, ORIF, all that kind of stuff. Anytime anybody has been forced to be non-weight bearing, maybe having a bunionectomy, having a total knee replacement. Now that's usually not non-weight bearing, but it will radically alter your gait on one side. You're not going to be putting a lot of weight on something that just had a traumatic, massive surgery to it, right? So that can affect your pelvic floor and lead to some weakness. Your pelvic floor muscles are oriented in a way that they get stimulated by hip rotation, which is turning in and out. And you saw all those anatomical pictures, right, where the rotator fascially connected to the pelvic floor, so you know how that happens. And of course, the good news is this can be improved if you've ever had a total hip replacement or some other reason that hip rotation decreases, right? And if you're sedentary, which I mentioned earlier, if you're sedentary, you rarely bear weight on your feet with normal rotation in the hips and ribs, your pelvic floor lacks the firing of the muscles that occur from the rotation, which begins with eversion at your ankle. And this is why many people become incontinent when they're wheelchair bound or they're sedentary. So let's discuss why Kegels doesn't resolve these issues and can even make matters worse. When you can, and this is for people who have organ prolapse, okay? Kegels can actually make the problem worse. When you contract the sphincter muscle all day by consciously thinking about it, you will rarely see any restoration of function. And why? I'm sure you all could answer this question, right? The pelvic floor muscles function as an automatic subconscious and submaximal function. Studies show when the hips are shut down or not working, or the thoracic spine isn't functioning normally, pelvic floor dysfunction is the result. Movement turns on those proprioceptors. That's the nerve cells that are concentrated in your joints and tell your muscles what to do, which turns on muscles that need to react subconsciously to support the bladder. So you cannot consciously contract your sphincter and elicit improvement in pelvic floor function. It just doesn't happen.